It's Erin with Best Life Physical Therapy again, and today we're going to talk about how to completely void your bladder when it feels like the bladder is still holding on to urine and you've already gone to the bathroom. So first of all, we really do recommend using a Squatty Potty. That is a little stool that goes around the toilet. Your feet are up on the stool and your toes are on the little footprints of the Squatty Potty, and the toes are slightly pointed inward. This brings our hips into a little bit of internal rotation and the knees higher than the hips because your feet are up on the stool. So you don't necessarily need the Squatty Potty. You could use a different stool, but the Squatty Potty really does put you in a fabulous position for complete emptying of both bowel and bladder. So the reason I mentioned emptying bowels when we're talking about urinary retention is that sometimes there is some retained bowel matter that's pushing forward from the rectum into the bladder, and that might actually be preventing the passage of the urine from the bladder. So what we would want to do is make sure that with every void that you take, that your feet are up on the stool, toes are pointed inward slightly, and that you are going to go ahead and exhale, because if there's an open glottis, there is an open anus. The fecal matter can come out completely, and then that will leave the bladder in a great position for a complete bladder void. So what we'd want to do for a bladder void is go ahead and just try to relax the pelvic floor muscles. Sometimes what happens is the bladder is a muscle and it will contract, and maybe sometimes that could be painful, maybe because it remembers an old infection or something like that you had with a urinary tract infection or something like that. So the pelvic floor muscles got tense because the tissues were infected at one point in time, and they remember that, they remember holding that tension, and they forget to go back to normal. So sometimes we have a tight pelvic floor, and if that's the case, what we can do for that is take a breath into the whole canister. So that means sides, back, and bottom. The breath can move into all of those positions, not just forward into the belly. And then that will help to drop the pelvic floor. And if you can feel a little bit of a drop with your inhale, then go ahead and drop it a little bit more. Actually allow that pelvic floor muscle to kind of drop a little bit more. And then it may make it a little bit easier for you to have a urinary void. Now, sometimes there is a little bit of a prolapse, and so what you would want to do in that case is actually do some pelvic tilting. So you're on the commode, you're going to go ahead and pelvic tilt backward, and then you'll come forward, and then back again, and then see if you can void again. Try to see if you can relax, take that breath that we talked about, and see if you can allow that void to happen. Now, if we're still not getting a complete void with that, then what I will have you do is take your hand in a fist, place it right over the bladder, right there, and put your other hand on top of that hand, and just give a little pressure like that. And that is going to be along with that breath in, and then that drop if you can, and then you would put the pressure and see if you can continue relaxing the pelvic floor and see if that void will complete, and you will get a complete void. Now, overarching all of this is the control of the autonomic nervous system. So we have a lot of other vagal toning exercises and techniques that you can do to calm the nervous system, and I would really recommend that you do those first when you're feeling like you have bladder retention, because the bladder is under the control of the autonomic nervous system, which is in our brain up here, and it's a cranial nerve, and it goes all the way down to it's the traveling nerve. It goes all around the body, but mostly it ends at the external anal sphincter, and it does have control over our bladder. So if you can use vagal toning techniques to calm the nervous system, that can also help you to allow that complete void and to restore any urgency or frequency issues that you're having as well. I'm Erin Wilson with Best Life Physical Therapy, and if you'd like to check out some of our other videos, you can do that here on our YouTube channel. Take care.